so vain. You probably think this song is about you. You're so vain. I bet you think this song is
10:36 on this first day of Heart Awareness Month. Laurinda Harjai, brand new to OSF Healthcare. Somewhat in October, you joined the team over here.
That is correct.
And how has it been in the first couple of months?
It's been wonderful. Been very welcoming from the community standpoint, and we're getting really busy quickly over there.
That's what I've heard, and it seems like folks are happy to have you here.
Yes.
And that's a great thing. And I always value our time with OSF Healthcare and talking about very important things like Heart Awareness Month. And right off the bat, before we go into the deep dive of it, take me through your background in cardiology.
Yeah, so right from the beginning when I started my career in healthcare, I really always enjoyed working with cardiac patients, mostly at that time in the cardiac ICU. So a lot of patients who had recently had either open heart surgery or patients who recently had a heart attack or suffered from congestive heart failure. And that really just led my nursing career to want to just continue to work with heart patients. And then I went on to become a nurse practitioner and really just have stayed working with cardiology ever since.
Absolutely. And as we're talking about February, it's always, I think these months are important because it's always good to give you that mental check of, hey, maybe I should go and make sure everything's working okay or everything's sounding good. Is this an appropriate time to really look at those things that we have going on in terms of our hearts and making sure we're all moving okay?
Yeah, absolutely. I think it's a good time to, like you said, bringing awareness. When is the last time I've seen my primary care doctor? What has my blood pressure been? What is my cholesterol? Do I have diabetes and not know it? So I think it's just really important to follow through.
Well, and when we talk about, preventing heart attacks and preventing these things, sometimes, it seems like, well, can I prevent these? Is the answer yes?
The answer is absolutely yes.
Awesome. And as we're talking about this, what are some of the risks of the heart disease and any type of heart event? As we're growing up with what we're eating, with what we're consuming, I'm sure that plays a huge factor in it.
It certainly does. So number one, it's very important that anyone who smokes, we always talk about it, and even when I'm coaching and talking to patients in the office, I know that's a big one for people to stop, but anything that we can do as providers to help with smoking cessation, but it is an increased risk factor for sure for cardiovascular disease. So if you smoke, you might want to think sooner rather than later to get those follow-ups.
Sorry, don't let me cut you off.
No, you're fine. In addition, again, knowing what your blood pressure is. So blood pressure is always termed the silent killer. So unfortunately, a lot of people don't know that they have high blood pressure. They think that maybe the fatigue they're experiencing, the headaches that they have, or maybe just slowing down and not being able to do what you normally had done in years previous or months previous. They chalk that up to maybe being a year older, but really coming in and knowing what your blood pressure is and managing it. And then along with that is simple blood tests to know, do you have diabetes or pre-diabetes, as well as what is your cholesterol levels? Because like you had mentioned earlier, the American diet, we all know fast food, it's great and convenient as far as convenience and maybe sometimes cheaper, but what is it doing to us, and just really knowing our numbers.
Absolutely. And one thing I wanted to point out is, a quote that was in some of that prep documents, and the best way to not have a heart or to survive a heart attack is not to have one.
Exactly.
And it seems like a lot of that has to do with our lifestyle choices. When you're talking with a patient or just meeting with them maybe for the first or second time, how important is it for you to get a gauge on what their lifestyle is like, outside of the patient encounter, but also their day-to-day life as well?
Right. So I ask them questions. One, it's always important to know what family history is. So do some of these patients already have a predisposition, maybe genetically, to early heart disease? Mm-hmm. But also, how sedentary are they? So are they on the couch a lot, or are they quite active, where I find people who are more active are more in tune to these subtle changes that may be happening day to day versus someone who's more sedentary. And we do often talk about sitting as the new smoking, right? So just having inactivity, American Heart Association, they want people to work out at least 30 minutes a day of brisk activity. Mm-hmm. And I encourage patients, hey, if you've had a sedentary lifestyle, we're not going to go couch to 5K overnight.
Good point. That's a good point. Realistic.
But if we can just, go to maybe it's 1,500, 2,000 steps a day and work our way up to what we'd like to see more like 8 to 10,000 steps a day. Take the stairs, park further away, those types of changes.
When it comes to a situation like that, because I'm sure that a lot of times you have somebody that might have a sedentary lifestyle but might also smoke on top of that or have some bad eating choices or eating habits. Is it, okay for that person that's going, man, I got a mountain to climb and I got to get all this in order to take baby steps and maybe tackle one thing at a time? Or do you recommend really going in and really getting this going right away as soon as we can?
When it comes to physical activity, I think it's the baby steps and working your way back up because you don't want to have, muscle fatigue and really do too much day one. But the part that really is important is seeing your healthcare provider first.
Yeah.
So making sure that if you have high blood pressure, it's well managed. If you have diabetes, it's well managed. So partner with your healthcare provider. So let us work with you to get that managed, and then maybe finding a partner to work out with or online groups. There's various ways now, I think, that people can work towards getting their physical activity increased.
I wanted to ask you about heart disease in young people, because that's something we're starting to see more and more of. And I don't know if it's the case, but it just seems a lot of the big news channels are really starting to have more of these segments on about, maybe a pre-workout causing some issues or some type of energy drink. Is that something you are experiencing over at OSF too?
Yes, absolutely. So that goes into, what we're seeing with dietary changes, the American diet, smoking, is that we're seeing heart disease in younger patients. So really 20% of patients that have heart disease are young. I mean, we see it in 20. So we're treating patients in their 20s and throughout their 30s who have actually even had heart attacks. So I think it's just really important. It sometimes is a disbelief to patients when they're that young that I didn't think I could have a heart attack in my 30s, when you absolutely can. But again, it's taking in all of those risk factors. So I think it's never too young to really just keep in touch with your primary care provider first off, and then putting all of those other risk factors and seeing a cardiologist when needed.
Well, and on top of that too, as we're talking about, younger people, I'm sure there's an anxiety when you have to have that conversation of you do have this type of issue going on. Is that something because I'm sure they think, oh my goodness, my life's over. I'm going to be, I hate to say it, but hurting or dying in 10 years, because with my anxiety, my brain, the way it works, that's what it immediately thinks is, oh my goodness, this is it. How are you able to combat that with, here's how we manage this, here's how we get through it, we're here now, but we can still handle it. Is that somewhat difficult when it comes to a younger person?
I think it's difficult for them. I really focus on reinforcing and encouraging the younger population who have heart disease and heart issues, that there's wonderful medications, technology, and that we can make the heart strong again if it's weak. We can combat the things that are really attacking the heart, for lack of a better word, and help patients to really recover either their heart function or manage the disease process so that they can go on to be parents, grandparents, and live long, healthy lives. So that's what makes it exciting and rewarding for me.
I bet, because there is a tomorrow.
Absolutely. Absolutely.
There was a statistic on here that I found really fascinating. That's one person dies every 33 seconds from a heart-related disease, illness, heart attack, stroke. What my question is for you, does that account for any type of natural causes? Because I know sometimes if you see it, it died of natural causes, 9 times out of 10 it could be a heart attack. Is that taken into consideration?
Yeah, that's all encompassing for any cardiovascular. So heart, stroke, or what we call peripheral vascular, so arteries that may, clog or cause issues in the legs and the limbs. We've seen people with amputation, so that's peripheral vascular disease. So arteries that clog in hearts can also clog in arteries in other places of the body, including arteries leading to the brain and to the legs. So.
And another thing I've heard about too, and this sounds silly, I'm being serious though. I was watching Duck Dynasty 12 years ago. Okay, I know. I know. The uncle on there, the older uncle, says, well, I had 7 heart attacks and never knew about them. And I thought, okay, come on, this is fake. but it wasn't.
No, it's not fake.
Can you take me through these silent heart attacks and what to look for in those? Because, I mean, I know about TIAs. Are they the same thing?
Not necessarily. Well, with silent heart attacks, what we're talking about is, so it's typically seen more in diabetics. It's more prone in diabetics, and then an older population, so greater than 75 years of age. But you can have a silent heart attack at any age. And a lot of it is, patients do have that heart attack. They don't even know they had it. They don't feel the symptoms. They don't feel that crushing chest pain, something like you might see on a movie or on TV.
Yeah.
Exactly. But heart damage will be done, and then it might be found later on where a patient may go to the doctors or the emergency room from an unrelated incident and see that their EKG has changed, and it is confirmed that maybe at some point in the past they have had what's called a silent heart attack.
And it just makes sense on why you should always go to that primary care provider and get that routine, checkup and that I always call it a maintenance report for me. Like I'm a car, a lot of city miles on me.
Exactly.
But it seems like that's really the best way to handle it. Is that correct?
Yes, absolutely.
Whenever we're talking about women and men, I'm sure lifestyle goes into a huge factor for the statistics too on, but I also saw women are more likely to die from a heart attack than men, actually 20% higher according to the notes. Is there a reason for that? Is that genetics, or does that have to do with more of a lifestyle choice too?
So a lot of it with women has to do with different symptoms of heart disease.
Okay.
So we always have to be careful when we're talking to women versus men in the office and screening for heart problems. So typically for men in heart symptoms, they'll get chest pain, maybe radiating to the arm, increased fatigue. But a lot of times for women, it may be presented as nausea, maybe back pain, shoulder pain, jaw pain. Wow. So men can have those as well, but for women, it may present much differently, so they're not realizing that nausea that they're having is really coming from the heart, and maybe they're passing it off as GI symptoms. Wow. So that being unrecognized and unnoticed, and then if they have a silent heart attack and then have congestive heart failure maybe because of that, that's how women really just aren't doing so well in the long term.
On following up on the heart attack and silent heart attack and just those episodes too, what is the average duration for a heart attack episode? I guess is the only thing I could think of to call it. Do they normally see shorter durations? Do you have an experience that lasts for like a stroke where you see those things happening, or is it pretty quick and instant?
So there's different types of heart attack. So there is the emergent heart attack where it's the patient's just having maybe that crushing chest pain, nausea, something's going on acutely, and an artery is occluded where it needs immediate attention. So that's when you're calling 911, you're having that chest pain, you're not going to let that go away, or the nausea or the back pain. And we need to make sure that that artery is intervened on right away. Mm-hmm. And then there's different types of heart attacks where it's not life, emergent, but it is causing some muscle damage, and we want to make sure that's treated in a timely manner. So those patients come into the hospital as well, but we get them on IV medicines, and we make sure that they get their heart catheterization, and if they need stents or surgery to support those patients as well.
Absolutely. You got a moment to stick around?
Absolutely.
I got to pay a quick bill. It's 10:50 on this first day of February. We'll take a quick break, and we'll come back right after this with more conversation.
Putting trouble on the run. Man, you found the hole in yon, twisting the night away. Yeah, twisting.
Welcome back, 10:52. A little bit of change on this first day of February. We're almost out of winter. Only 3 more years. As we're getting back and talking, Laurinda, you've been here at OSF for a couple of months now.
Yes.
And at this point, how has that experience just been for you? Because you've had a pretty, extensive background and been able to do some remarkable work. Being at OSF, what's that feeling like for you?
It's been great. The community's been very welcoming to having me there. I'm 5 days a week in the clinic and in the hospital, so I think it's been great to have continued cardiology presence and to collaborate with other specialties and primary care to really help serve the population here. So it's been great.
And what are you noticing just with the patient experience too? Because I'm sure every hospital and every facility has a different set of measures and a different set of processes. But at OSF, do you think that they're really providing an opportunity for a streamlined and efficient process for folks?
Absolutely. I really feel like the vision that they have for specifically cardiology is really just to be able to provide top care to patients and really work with the goals of getting back to preventing heart attacks, preventative medicine, being seen, access to care. So you don't have to drive so far to maybe see a specialist or subspecialist. So I collaborate with other cardiologists locally to help also provide more extensive care for that population that may need certain specific cardiology care.
Another thing I didn't even think about was there's always that moment, I'm sure, that especially when someone first has their heart episode, especially, man or woman, as they're getting older, that kind of thought process finally hits you of, I'm not as young as I used to be.
Right.
Do you have quite a few of those conversations with, you might not be as young as you used to be, but you still got a life to live?
Absolutely.
Do you? That's what I was wondering.
So I really think it's just important to support patients through, the whole the pathway through the realization. We don't want to think about it ourselves, right? You start questioning like, oh, that's right, my own mortality. But really just supporting like what we can do to serve the patients at any part through their healthcare process.
And, I haven't asked you that. I asked you on the during a break, but not during the live show. What's your day-to-day breakdown look like? Because I know that you got a lot of irons in the fire, just like the team over there at OSF. But what does that breakdown look like for you and your processes?
Yeah, so they're keeping me really busy. I think it took off much quicker than we even anticipated, but all for the good. I call it a good busy.
Yeah.
And so I come in, quite early in the morning, try to get there by 7:30 in the morning. I see what's going on in the hospital, what has come in overnight. Are there new patients or patients that have come back that need to be seen by cardiology right away? So I do the rounding, talk with the hospitalists, chat with the office to see what's going on. Do we need to squeeze anybody in for appointments that day? And then we have a pretty full clinic. And then I go back and check back with the hospital before I leave. And so it's great, but I continually closing the loop on this patient care. So.
What I think is unique, too, is every care provider I've talked to from OSF talks about the relationship that they end up developing with their patients because of the way OSF does provide care. Is that something you've noticed too, that you're able to have a little bit more of those one-on-ones and those just really, not personal, but in a way personal interactions that make that care feel more, more prioritized?
Yes, I think that's what you get from this type of community setting. You really feel like an extended family member. And I even make jokes with many of the patients about, I'm going to be the younger nagging daughter or whatever, but it's because we care, and I like patient visits. I like to give all the patients the opportunity to have their questions answered, their concerns addressed. It's just been really great. This is the type of setting that I've enjoyed most throughout my career of being in.
Absolutely. Well, Laurinda, I really appreciate your time today, and I know you're busy. And what's your final thought just to folks? If you had one note to really help somebody maybe help themselves today, what would that tip be?
Yeah, if you are having any symptoms, any risk factors, or any concerns, I think I'd talk peace of mind always in the clinic. And just kind of one little last note is patients will come in and say, well, what if it's just indigestion? And I always say, but what if it's not? And I'd rather let's do the workup, let's do the tests, and give you peace of mind and get the right answers. So don't hesitate, don't push it to the back burner. If you have a concern, it's likely legitimate, and come see, either reach out to your primary care provider and they'll work with us if you need to be seen by a cardiologist.
Absolutely. Laurinda, thank you so much for your time. Thank you for being here at OSF Healthcare, and we're looking forward to having you here for quite a bit.
Thank you. Thank you for having me.
No problem. 10:57, we'll take a quick pause and wrap up the first day of February right after this.